I'm Dr. Jen. I'm a double board certified fertility doctor. And today I thought it would be interesting to ask ChatGPT about different patient scenario and see if I, as a fertility doctor with over 15 years of experience taking care of patients, agree with what ChatGPT says or what I would add to it, or if I think it's pretty good. So I know I use ChatGPT to ask medical questions sometimes, especially in other specialties not related to fertility. And I'm always sort of wondering how accurate it is. So I thought it would be interesting to, in real time, just ask ChatGPT questions about a certain patient case and see if I agree or would add anything or take anything away from what ChatGPT says. So I'm going to ask ChatGPT what fertility treatment does a 40-year-old who's been trying to conceive for 6 months, what fertility treatment would you recommend? So let's see what ChatGPT says, and I'll see if I agree. Okay, so ChatGPT is coming back right away saying a 40-year-old who's been trying for 6 months should move directly to a fertility evaluation, not wait, and will often benefit from treatment that improves the number of attempts per month. Usually ovulation time to medications, IUI or IVF, depending on testing results. And age 40 changes the timeline because egg quantity and quality decline more rapidly, so early evaluation and treatment are recommended. So far, I think that's actually really good. So I do think a 40-year-old, usually as a fertility doctor, I would say come in even sooner as a 40-year-old, maybe even as you're starting to try, because you want a basic evaluation done, and you want to look at your egg count. You want to look and make sure your uterus and fallopian tubes are okay, and your partner's semen analysis is okay as well. So because ChatGPT does make a good point that at age 40, quality and quantity of eggs do decline rapidly. So how quickly do they decline? I mean, I can see declines over a 3 to 6 month time period in a 40-year-old, both in terms of egg quantity and quality. It really is pretty rapid. It's pretty much across the board for everyone who's age 40, no matter how extremely healthy they are. We see this. There's something super tied to age, especially with how well eggs work. I will say women at age 40, different women will have different amounts of eggs. So that is part of the workup to check the amount of eggs because that can be a little bit variable at age 40. But the decrease in quality is pretty consistent across women at age 40. All women at age 40 will have a decrease in how well their eggs work. That's how I like to describe it. Because the eggs just make mistakes. So most of them at age 40 will make a mistake when it goes to fertilize. So the fertilization and growth of the egg, there will be problems with that in most eggs in a woman at age 40. So what happens is the chromosome number is incorrect. Actually, the egg can fertilize and grow. Normally it can look really good, but have totally the wrong number of chromosomes and never actually have a chance to grow into a baby. That happens with most eggs when you're age 40 and above. So that's why it's so urgent to come in for evaluation and treatment because of that. That's the main reason. And that's why I used 40-year-old in the prompt, because age is such a big thing with everything we do, because it really determines your type of treatment that you are. So if I had a 20-year-old come in who had been trying for 6 months, or even a 30-year-old who had been trying for 6 months, I would recommend a totally different type and timeline for fertility treatment because of that huge change in egg quality and quantity between age 30 and 40. It's so dramatic. You just can't even emphasize it enough. It's like completely different fertility treatment at age 30 as it is at age 40, and how the eggs respond. Totally different. So far I think it's pretty good, because the treatment, it kind of improves the number of attempts per month. And what does that mean? It means that usually every month you ovulate usually 1 egg, sometimes 2, or very, very rarely more. That's how you can get twins naturally, if more than 1 ovulates, but it's unusual. Usually 1 egg ovulates per month, and you have 1 chance per month. So with fertility treatment, we are increasing the number of eggs. So like with IVF, you can get a whole group of eggs to grow and collect them. So it's true, you get more chances at once, which is helpful because as your egg quality and quantity is declining pretty rapidly, if you're only getting that one chance per month, that's not gonna be as successful, especially because we know most of the eggs aren't gonna work properly. So if you can get a whole group of eggs and get a whole bunch of chances at once, it gives you a better chance to get pregnant before that decline keeps happening. So far, pretty good. I agree. That's just the first paragraph. Let's see what else ChatGPT recommends. So it says what you need right away is a fertility workup. So that would check your egg reserve, your ovulation and hormones, tubes and uterus. Yes, that's what I just said, and partner testing. Yes, I agree with all that so far. It's basically similar to what I said. So you're going to check your ovarian reserve. That's your egg supply, because that can be different with different 40-year-olds. It's always going to be lower than when you were 30 or even 35, but person to person can vary a little bit, your ovarian reserve. So I do recommend that. And it's ChatGPT is saying AMH, day 3 or day 3 FSH and estradiol, or an antral follicle count that's done by an ultrasound. And this helps guide treatment urgency and dosing. That's true. I mean, I would say treatment urgency is pretty much already, for me as a fertility doctor, guided by age. Like I don't use the ovarian reserve testing to guide urgency. So I would say maybe that's something a little different there, because we'd guide treatment urgency based on age. Already I know that treatment is urgent because of the age and what I know happens in a 40-year-old, into their egg supply, into their egg quantity and quality. So, but dosing, it does help in going to fertility treatments. It can help to dose medications, especially AMH. It can help dose the medications, as can that antral follicle count. So what are these things? So AMH is a hormone. It's a blood test that you can take at any time in your cycle, any day in your period. And it will give you an idea of your egg supply. And it is helpful because lower egg supplies don't need as high dose medication, which is nice. That's something that I have a lot of experience in, is like personalized dosing of medications, which is different than a lot of places. Unfortunately, a lot of fertility clinics need sort of more of a one size fit all, either because they're part of a big fertility network or big insurance network. They need to be very strict with their protocols and not personalize them very much. That's not so good, especially when you're over age 40, because you really need a more personalized IVF protocol, as you can probably tell, because you don't have a lot of time. A lot of times your egg supply is lower, and it can vary person to person a bit at age 40, your egg supply. So it really, really is so helpful to have a personalized approach to fertility treatment in IVF. So that's something I've practiced for a number of years. I think is really important, but it's actually kind of hard to get, just because of the corporate business of medicine, I would say. But anyway, so an AMH will tell you your egg reserve. And so will a day 3 FSH and estradiol. The problem with the day 3 FSH and estradiol is that you have to do it on a specific day of your period. So you have to do it on day 2, 3, or 4, I would say. They call it day 3, but you can do it day 2, 3, or 4, and it's still going to be pretty accurate. But that's kind of a pain because you can only do it once a month. And if your estrogen happens to be off at the beginning of your cycle, which happens when you're older, your estrogen could be high. Maybe you have like a cyst that's resolving. There's different reasons. You can have premature follicle growth when you're older, and that can cause a higher estrogen in the beginning of your cycle. And if your estrogen's high, you won't get an accurate FSH. So it's a little bit like, it's an older way to check egg reserve. It's still useful, but it's a little bit more of a pain to do and get accurate sometimes. But it's definitely a very traditional, good way to check ovarian reserve. So if your FSH is high, as long as your estrogen has to be low to get an accurate read on your FSH level. So if your estrogen's low and they're in your 20s, 30s even, you're going to get an accurate day 3 FSH. If your estrogen's elevated, it suppresses your FSH and you won't get a real read on your FSH. So that's something to know. antral follicle count is something I like a lot. I find it very useful. I do a lot of ultrasounds for my patients, and I can actually see with my own eyes how many eggs are in the ovary. So what I see in this case is not all the eggs a woman has, but each month you have a new group of eggs that are selected that will start to grow. And that's a group I can see. It's called the antral follicle count. It's better when it's done in the beginning of the cycle, when sometimes when you're still in your period, which can be not the most fun. Most people don't like it because we have to do it when you're on your period. But why that's a good time to do it, because you don't have a dominant follicle growing yet. Because when you have a big follicle start to grow, it can block those little antral follicles and you can't see them as well. So it is really convenient to do that at when you're on your period, because you don't have, most times, I mean, sometimes the cycle can be off and I see dominant follicles when you're on your period, but most of the time you don't have a dominant follicle at that time. And so it's a good time to do this antral follicle count. So where would I expect an antral follicle count to be for a woman in their 40s? So this, even though it's not all the eggs in your ovary, it is representative of all of the your remaining egg supply. So when I see that follicle count, I can get an idea of a woman's egg supply. It really helps me when I'm dosing medication, say for IVF, even for IUI, it can be very helpful. So I would say when it's low, I'm maybe seeing like 2 follicles in an ovary, and each ovary 2, 3. You know, if I'm seeing 3 to 4, then I'm happier with that egg supply, and the number of eggs we'll be getting at IVF. But sometimes I've even seen more than that. I would say rarely. I see maybe 6 to 8 in each ovary in a 40-year-old. That's sort of the range, and very, very rarely more than that. But have I ever seen it? Yes. But that's sort of the range that I see in a 40-year-old. Most commonly, maybe like 3 to 4 eggs in each ovary would be more common. So that's, or antral follicles, they're technically called, not eggs. So far, I think ChatGPT is doing a really good job. So follow me, subscribe, and tune in for part 2. So I'll complete the workup, tell you what I think about the workup, and move on to the treatment. So what treatment should this 40-year-old who's been trying for 6 months, what type of fertility treatment should she get? I haven't even gotten to what ChatGPT said yet, but let me get to that and I'll tell you what I think. So please subscribe, follow along for part